Hi everyone, welcome once again to another episode on Health Up with Fifi. On this channel, you are rightly informed about all health topics and everything that comes with it. So stay tuned. This is another episode on Health Up with Fifi where we will be looking at appendicitis. What appendicitis is, the causes, complications, treatment, risk factors involved, and others. Now, if today is your first time on this channel, I would like you to subscribe to our channel. Kindly subscribe to our channel and make sure you are following us on all social media platforms at Health Talk with Fifi, and let's get interactive. Now, let's get into today's video. So we'll be looking at appendicitis. Now, before we look at appendicitis, you have to know what appendix is. So those of you haven't seen what appendix is, so it's a small finger-like shape. So it's as small as our finger. So it is located at where the large and the small intestines meet. Where the large and the small intestines meet, just at the lower abdomen, our right lower abdomen, this part. So it is small finger-like punch, let's say organ, that is located at our right lower abdomen. So where the small and the large intestines meet, that is where you can find this appendix or this organ we are talking about. Now, appendicitis is the inflammation of the appendix. I repeat, appendicitis is the inflammation of the appendix. Now, how can this appendix get inflamed? The causes of appendicitis is idiopathic. We don't know the exact cause that brings about the inflammation of the appendix, but it is believed that it commonly occurs when there is a blocked feces or there is a foreign body, for instance, seeds of fruits or seeds of fruits and other foods. So when these foreign body or rarely tumor blocks the appendix, it gets inflamed. Then there will be overgrowth of bacteria, which will cause infection and make the appendix inflamed. Now, so this is what we believed scientifically and medically, but the actual cause of this appendicitis is unknown. That's what we say. The cause of appendicitis is idiopathic. Idiopathic simply means not knowing the cause of a condition or a disease. So it is idiopathic. Now, what causes appendicitis? The actual cause or the main cause of appendicitis is idiopathic, which simply means we don't know the cause of idiopathic. But it is believed that normally or mostly it occurs when the appendix is blocked. So when the appendix is blocked by feces or a foreign body, example, a seed of fruit or any food seed, or rarely a tumor. So rarely a tumor, which also can be a foreign body in the appendix, can cause the appendix to be blocked, and this will lead to overgrowth of bacteria and later cause the appendix to inflame. So mostly this is what happens. It could be as a foreign body blocking the appendix, or a hardened stool, feces, blocking the appendix, or rarely a tumor, which will cause overgrowth of bacteria and later inflammation of the appendix. So this is what mostly happens for someone to have appendicitis. Now, what are the symptoms of appendicitis? If I have appendicitis, what will prove or what will show that I have appendicitis? What will I see? So there will be a dull pain near your navel. So that pain or the pain at the upper abdomen becomes sharp when it goes down, but at your upper abdomen it is dull. So getting to the lower right abdomen, the pains become sharper to the extent that you can't even press or touch that particular part. So as it moves slower, lower the right abdomen, the pain sharpens or becomes high, but at the top of your abdomen or upper abdomen level, the navel level, it is down. Okay, now let's look at symptoms of appendicitis. So if I have appendicitis, what will show or what will I see to say that I have appendicitis? So there is a dull pain, a very mild pain getting to your navel or the upper abdomen. There is a dull pain, but getting or the pain becomes more sharp or it becomes intense when you are getting closer to your lower abdomen, that is the right lower abdomen. That is where the pain, because that is where the appendix is. So when it is inflamed and during palpitation, you can see it is tender, it is painful as well. So sometimes it is painful to the extent that you can't even press that particular part, the right lower abdomen. You can't even press it so well. So this could be a sign of appendicitis. A symptom of appendicitis. Another sign or a sign of appendicitis could also be swelling of your abdomen. So when you see your abdomen swell, it can also be as a result of appendicitis. But the symptoms are pain in your sharp pain in your right lower abdomen and a mild pain in your upper abdomen getting to where your navel is. Okay, so another symptom of appendicitis is loss of appetite. So if you are having this sharp or intense discomfort in your right lower abdomen and you've lost appetite as well out of the blue, then it can also be a symptom of appendicitis. Nausea and vomiting. When you feel nauseous and you vomit frequently or unusual, it can also be as a result of appendicitis. Then we have fever, moderate fever can also be a symptom of appendicitis. Abdominal swelling. As I mentioned earlier on, where you feel the pain, that particular part or that particular place can swell up. So when you see abdominal swelling, it can also be as a result of appendicitis. Constipation or diarrhea. I mentioned earlier that the cause of one of the cause of appendicitis is blocking of the appendix by feces. So when you are constipated or when you have consistent constipation, can also be as a result of appendicitis, and as well as diarrhea can also be so it could be consistent constipation or diarrhea as a result of appendicitis. Your inability to pass gas can also be a sign of appendicitis. Now, how do we treat appendicitis? So mostly surgical removal of the inflamed appendix is the treatment. Mostly surgical removal of the inflamed appendix is the treatment. Because if they don't remove it by surgical procedure, it may burst and will lead to a lot of complication, and one may lose his or her life. So surgical removal of the inflamed appendix is mostly, in 90% cases, is mostly the right way or the procedure for treating appendicitis. Sometimes antibiotics may be given in some cases to treat the infection which is causing the inflammation, to ease the pain or to reduce complications. So sometimes antibiotics may be given to people with appendicitis to cure the infection causing the inflammation, which may lead to complications either before surgical procedure or afterwards. So maintaining a healthy diet, a diet with plenty fiber, can also help treat or maintain yourself from appendicitis. So one should eat food rich in fiber. Make sure you stay hydrated, which will help to prevent constipation. and this constipation, which might lead to contribute to appendicitis. So one has to eat food rich in fiber or plenty fiber, stay hydrated, which will help you to prevent constipation that may lead you to have appendicitis. Now let's look at some risk factors of appendicitis. So age. Appendicitis can happen at any age, but mostly between the ages of 10 and 30. People within the ages of 10 and 30 are mostly having appendicitis per research. So it can happen at any age, but mostly it occurs between the ages of 10 and 30. Family history. When you have a family history of appendicitis, if someone in your family, your mom, grandmom, uncle, auntie, has ever had appendicitis and his or her appendix has been removed, or ever been treated for appendicitis, that is being given antibiotics because the inflammation wasn't that intense, it was mild, and was given antibiotics. So it could be that it is in the family, so that can put you also at risk of having appendicitis. Also, infection. Gastrointestinal infections by bacteria and viruses may also trigger the appendix to be inflamed, which will cause you to have appendicitis. So sometimes the infection can also make one to have appendicitis. Most importantly, gastrointestinal infection. Also, some medical conditions like Crohn's disease, ulcerative colitis, cystic fibrosis can also put one at risk of having appendicitis. So we have these underlying medical conditions: Crohn's disease, ulcerative colitis, cystic fibrosis. They all can put you at risk of having appendicitis. Also, previous abdominal surgery. If you've had any previous abdominal surgery which has left a scar, or later after surgery, post-surgery complications can also put you at risk of having appendicitis. So aside these risk factors, one can also have appendicitis without these risk factors. So you can have appendicitis aside these risk factors. But these are the general risk factors that can put one at risk of having appendicitis. And since the cause of appendicitis is idiopathic, one can have appendicitis anytime, not being as a result of the person falling into the risk factors. A person may be infected with appendicitis or may get appendicitis spontaneously. Diet. So people who eat low fiber diet is also at risk of having appendicitis because it will increase your risk of constipation. And when hardened stool blocks your appendix, your appendix will be inflamed. So when you eat food with lesser fiber, or your diet is mostly with less fiber, you may be at risk of having constipation, which will cause you to have appendicitis. Obstruction of the appendix. So anything that blocks the opening of the appendix can cause the appendix to be inflamed. So one of the examples of anything that can block is hardened stool. So as a result of constipation, your hardened stool that is not being able to come out can block the opening of your appendix, and will end up overgrowing the bacteria. Then will cause infection, and later the appendix to inflame. So foreign body can lead to inflammation as well as hardened stool, and rarely tumor, which will lead to overgrowth of bacteria, cause infection, and make the appendix inflamed. Thank you for staying with us on today's episode on appendicitis, and I hope you've learned about what appendicitis is, what actually makes us have appendicitis, some risk factors, treatment and some symptoms you would experience when you have appendicitis. And we know appendicitis is a small organ at where the large and small intestine meet. So it measures about 4 to 6 centimeters. So when there is imaging test and it's more than that, we can see that the appendix has inflamed, and we look at the rate of inflammation. If it is high and you need a surgical procedure, it will be done. So please make sure you visit the nearest hospital facility or the nearest health facility if you are having any of these symptoms of appendicitis for proper medical attention, because appendicitis is a serious medical condition or case that is emergency. So if you have any of these symptoms, make sure you rush to the nearest health facility for proper health care. Thank you so much for staying with us on today's episode on Health Talk with Fifi. My name is Adjoa Duma Ansa, and make sure you follow us on all social media platforms. Drop your questions and let's get interactive. This has been Health Talk with Fifi. See you same time next week. Bye.